Hi everyone, happy Monday morning. It's Jenna Walsh, registered dietitian, certified diabetes educator. Thank you for joining me for our Food in 15. As I mentioned last week, I'm going to focus more on some of the pediatric based questions I've had come in. Hi Kelly. Again, I'm working from home like most of you, so I apologize in advance if you hear stomping above my head, sort of the new nature of work. So you did make it. Yay. So I've had quite a few questions come in since I've started doing this about kids in particular. Prenatal questions as well in terms of, is this true that I can or can't have this while I'm pregnant or while I'm breastfeeding? And then a few questions too around baby-led weaning and also picky eating. So we're going to jump into those as well. So I'm going to start with the prenatal piece, right? There's lots of questions, a lot of misinformation as well that can start as soon as you're pregnant, right? There's so much information, there's so many things to be aware of, and also sort of traditional information and guidelines that's carried along from, grandparents and parents and what they did or didn't do. So we're going to start there. Basically, one of the big things is, do I have to take a prenatal vitamin? I really am a strong believer of vitamins and supplements have their place in general in our diets if we're not eating well enough that we need to have that extra buffer to fill in those gaps, right? So we've talked before of the vitamins and minerals, they don't give us energy, but they help us use the calories that we need. Now move that into, while you're trying to grow baby, we have really specific amounts of those little tiny nutrients that we need to help our own body, but then also to support that baby developing. The biggest ones you're going to come into where we really see a need is folate, folic acid, and iron are big ones, okay? So blood volume is expanding while we're pregnant to help support baby. Folic acid is super important in terms of neural tube defects. So we don't need a ton in our diet. Recommendations are around 400 micrograms, especially during pregnancy. That being said, it's a little bit challenging sometimes, depending how we're eating, to get enough through food. So when we look at it, best sources are really from folate and folic acid that's added to food. So things like cereals and breads. We also get a lot through dark leafy greens, things like edamame beans, beans and legumes like the pulses. Now, you may eat well enough day to day and be able to get lots of folic acid in your diet. For any of you who've already been pregnant, if you've had any nausea, it's sometimes really hard to eat a lot of those foods. And so the biggest thing I would say, if you really think that you're eating super, super well, best at least take a folic acid supplement if you don't want to take the whole prenatal vitamin, okay? And, we take a look day to day in terms of, are you eating well? Are you eating enough? Are you getting a variety of foods? And then, it never hurts to take your supplements at the end of the day. So if it was one of those days that really you kind of survived on, toast and maybe an apple and whatever, and it wasn't that great, you take your prenatal vitamin. Iron is a big one as well. So some people have huge aversions to meat and pulses as well. So if you don't have a lot of iron-rich sources while you're pregnant, those would be the two that I would make sure you're getting enough of, okay? And if you're having any digestive issues, some people are really sensitive to the iron, even the small amount that's in a prenatal. Take it at night. Tends to be a little bit more gentle on your stomach. Okay, so that would be my suggestion there. Question in terms of how much extra do I actually need to eat while I'm pregnant? So that whole comment, I always heard it more from my parents and grandparents that, oh, it's okay, you can eat all of that. You're eating for two. You don't need double the calories. First trimester, really only about an extra 100 calories a day, which isn't much, right? It's like a banana, maybe a glass of milk, so nothing huge. Into second and third trimester, we're upwards of like 300 to 500 calories, a little bit more if you're having twins or multiples. So it's really just like an extra kind of snack or small meal in a day. Every once in a while, if that's like treat foods, totally fine, but you do still have extra protein that you need, and extra omega-3 fatty acids that you need, and extra fiber, and again the folate and the iron. So we do still want to try to make an effort to make it a nourishing extra 300 to 400 calories. Okay, so that question also sort of spans into breastfeeding. A lot of people don't realize if you're choosing to breastfeed, you still need those extra calories. So it's kind of like elongating that third trimester. You still need somewhere between 200 to 400 calories extra a day to support your body to make enough milk. Okay, so again, first trimester, really not much, an extra piece of fruit maybe. Second, third trimester, kind of an extra mini meal. That's it. Good. One person wrote in and asked, any truth to, I was advised I can't have any coffee while I'm pregnant. If you don't drink coffee and you don't need it or want it, you don't need to have it, obviously, while you're pregnant. You absolutely can have coffee, though, while you're pregnant. Recommendations are around 200 milligrams to max out at, which is about 2 cups of brewed coffee, depending how strong you make it. There's different caffeine levels in different foods, so teas, your chocolates, energy drinks, those kinds of things, those are a little bit iffy because they have a high amount of added vitamins. So you want to be careful, especially while you're taking a prenatal vitamin. The biggest thing with caffeine, right, is the theory behind if we're drinking it all day is it restricts our blood vessel, so it increases our blood pressure, which can decrease blood flow to baby, right? So if you're having a lot during the day, that can happen. Also can make us feel more nervous, more anxious, which isn't great all around anyway if you're already feeling that way. Okay, so caffeine, totally fine. Herbal teas, there is a long list of teas that we sort of want to be cautious of taking. And mainly, again, in terms of using a little bit of judgment there. If you sort of accidentally, or you have a tea that's on that list of, do not have, most of the evidence comes from if you're having a high amount of those teas all day long, right? So if you're having a cup, may not have any issue. Black teas, your green tea is totally fine. Most of the citrus and ginger, totally fine. Some of the ones that are surprising for people, the chamomile, nettle leaf, the licorice root. So some of those are in a lot of the tea blends, like even the Feeling Soothed, that kind of thing. Okay, so there is a long list. If you need them, I do have a great prenatal resource that I can send you. So just shoot me a message if you need it. And the one other one around prenatal came up, and this will transfer also into the peds. I was told to limit my intake of fish because of the high levels of omega or of mercury. So fish is a tricky one at times because while we're growing baby and also afterwards, we need the omega-3 fatty acids. They are fantastic for brain development, heart health, as well as the fatty acids are good in terms of calories. So we absolutely want some of those fatty fish. Salmon, trout, sardines are fantastic. And tuna is okay. So when we talk specifically about tuna though, we do see higher levels of mercury in the fresh and frozen tuna, as well as in the canned albacore. So there are specific amounts. We try not to have more than like the two cans a week of the canned albacore. Other than that, it's like shark, swordfish, things that aren't very traditional around here in Ontario, so we typically don't talk too much about them, okay? So those are the ones that you want to avoid. Otherwise, salmon with the skin, lovely. The canned salmon, lovely. Trout, again, the sardines, all of that, fantastic to have, okay? If you and your family don't love fish, that would be another supplement that I would really recommend, and even for baby and toddler afterwards, okay? And we'll touch a little bit more on that in terms of their needs. Okay, I think I'm doing okay for time. One of the other sort of questions came around, starting solids, back and forth with guidelines of I should start at 4 to 5 months or I need to wait until 6 months. What do you think? So previously, probably 2 to 3 decades ago, it was, around that 4 months, 3 months sometimes. Then it switched to that 6 months. So we started to worry more about allergies and gut development in kids. And the guidelines really have kind of moved back to don't be so focused on the age as opposed to signs of readiness. So babe is able to sit up, they can support themselves, their head is upright. When you put something in their mouth, so whether it's a spoon or, your finger, whatever, that they're not pushing it out, so the tongue protrusion isn't happening as much. They're accepting food. Other than that too, they're showing interest, right? So if you guys are eating at the table, they're grabbing at your food, they want some. So those are the more important pieces. We're not feeding kids when they're like 3 or 4 months and they're in a reclined position in a bouncy chair or in a car seat. Some people think, oh, well, that's fine. It's a safe way that they're tilted. We want them to sit up. We want them to be able to sit forward so that if that gag reflex happens, they're already able to push that forward. Okay. So biggest thing that we're looking at, right? Anywhere between that 4 to 6 months that they are starting. You're not concerned in terms of, oh, you know what, they only ate a tablespoon. Is that enough? Milk, whether it's breast milk or formula, is still their main source of nourishment. As we jump into the 6 to 9 months, again, their milk or formula is still their main source of nourishment. Between the 6 to 9 months, we're really starting to get them more into feeding times, right? So that they're getting sort of larger meals or offerings of food, and then maybe a snack here and there. You will gradually, as they get older, start to feed them between their milk or formula feedings so that they're hungry coming to the table. When they're a bit younger, it's absolutely okay to, maybe breastfeed them or give them their bottle, and then within half an hour, have them in the high chair so that they're playing, touching food, they're smelling food, they're licking it, they may be spitting it out, totally fine. So as they get older, as they get closer to the 9 to 12 months, that's where we're really starting to reduce the milk and formula as their main source of nutrition, and we're starting to increase the food as their source of nutrition. Okay. So the biggest thing too, you'll start to notice that first 4 to 6 months and kind of 6 to 9, there's just going to be up and down kind of munching, right? So in terms of how many muscles it takes to chew and eat. As they move more into the 9 to 12 months, that's where they have the lateral movement of their tongue. So they can actually move food between their teeth. They have more variety. They can tolerate more textures and more sizes and whatnot of food. Okay. Only other thing too that I wanted to make sure, so if babes are breastfed, you do still need to make sure that they're getting vitamin D, potentially also the omega-3 fatty acids between that 6 months, kind of to like 9 to 12 months, depending if they're getting a variety of fatty fish. Okay. So those are the only two that continue. If they're taking formula, the vitamin D and the omega-3s are added into their formula, so absolutely okay. Good. So with that question also came some questions around, I'm hearing a lot around baby-led weaning. Do I need to do it? Should I be doing it? Etc. You absolutely can. I would not be comfortable in terms of just jumping into like a minute on that in this video, but completely safe, evidence-based. Babes can eat very, very well. Some babes naturally do baby-led weaning because they completely refuse the puree, or they refuse sort of that middle texture around the lumpy, and they just want the pieces that they can manage on their own. So that is absolutely okay. If there's enough interest to, I've done a presentation on it, so I can upload that as well. Okay, because the biggest thing is still that you're offering safe textures, the appropriate size of the food, that in the same way that if you were sitting there feeding them purees, you are sitting there observing them. Okay, and that's the biggest piece. So that is absolutely okay. Please PM me if you want more information on baby-led weaning, and we will do that. Okay, I had another question too around breastfeeding, and is it okay to have alcohol? And on that same note, is it okay to have cannabis? So there's tons of information, there's tons of misinformation. The most evidence-based comes from La Leche League, as well as from Dr. Jack Newman has done a lot of studies around alcohol transfer to breast milk and also the effects then on baby. There's obviously a dilution that happens if you have a drink. It is transferred into your breast milk because the alcohol is in your blood, right? So your blood vessels feed your breast tissue. When it comes to drinking, so it's not that we promote drinking while you're breastfeeding. The sort of support from La Leche League and Dr. Jack Newman is that we don't want to impose another restriction on breastfeeding moms. So by all means, most of the evidence shows absolutely safe to have, a drink within kind of 1 to 3 hours. And that 1 to 3 hours depends on have you eaten, how quickly your body metabolizes that alcohol. So that's going to vary. What we look at is, if you are planning to go out for a night and you're unsure of how much you're going to drink, you want to be prepared to not have to breastfeed when you come home. So we absolutely do not want to be intoxicated because you're putting your baby at danger just in terms of breastfeeding. And in case you fall asleep, there is some evidence that if there's too much alcohol in the breast milk, that it just makes the baby, they may be on the breast longer, but they're not going to be getting as much volume. So they're going to feed more frequently. And also it can make them a bit more drowsy. So always plan ahead that way, okay? There is no need to pump and dump because once the alcohol is out of your blood, it's out of the breast milk. So it does not stay in your milk. In terms of cannabis, though, completely opposite. It is stored in your fat tissue. The current guidelines do still suggest that if you're planning to smoke cannabis, likely better for your baby to not breastfeed, okay? Because studies have shown that the THC and CBD can stay in the breast milk anywhere from 6 days to 6 weeks. So if it's a daily thing, it's compounding the amount of the active component that's in the breast milk. There's really just not enough evidence right now. Most of the sort of effects are coming into the gross motor skills that babes are having then, and we're seeing delays. And also in terms of pregnancy, we're also seeing deficits in terms of their cognitive functioning as they're into the toddler years. Okay, so alcohol, yes, there's decent evidence there. It's quickly metabolized. Those guidelines still around, a drink, wait 1 to 3 hours, depending. And if you feel that you're intoxicated, likely don't breastfeed. Best evidence, okay? So thank you for that question, just so we can clarify between those two things. Okay, lastly, the question that I had was in terms of, again, I was told by my healthcare practitioner to double check whether my child is a picky eater or if it's something I need to have checked. So usually when that comes up, we're looking at the difference between, okay, it's very, very normal for kids to go through food jags. And what we mean by that is, they have that month where all they want to eat is peanut butter and jam sandwiches. And then suddenly one day they're like, I hate peanut butter and jam. Why would you give that to me? Totally normal. And that'll switch and they'll come back. The biggest thing that we look at in terms of, not worrying is that those foods that they're refusing suddenly eventually make it back into their life. Okay, so that's just normal eating. Kids also lose interest in food. They're less interested in it come kind of 2 to 4 years old. Their growth naturally slows, their appetite decreases. Totally normal. When we look more in terms of problem feeding, and I don't really love that term because it's just very, very negative, is that list of foods that they like and accept becomes smaller and smaller and smaller, and it stays small. And that risk there is more that we can sometimes then see nutrient deficiencies, right? Because if we're just eating apples and a piece of bread and maybe just chicken and maybe cucumber's the only vegetable, those foods only offer certain nutrients, certain vitamins and minerals. So we do a few things. We look at food chaining, and what that is that you're sort of thinking of like a ladder approach. So if they like chicken nuggets, and only a certain chicken nugget from a certain box that they're familiar with, we start with that chicken nugget. But then we maybe make a chicken nugget that's from home. You may sneak it into that box. You may put it on the plate with the other chicken nuggets or completely separate. And what we're looking at then is having them talk about we're having them talk about, what's the texture? What does it taste like? How does it smell? You can have them also make it with you. So they may actually just start with, hey, here's the one that I made. I'm not ready to try it yet. I'm still going to eat these ones from the box. And then maybe eventually once they do accept the homemade ones, then you might move on to a larger piece of chicken. It might actually just be like a chicken strip. See how they do with that. Then from there you may progress to like just a regular chicken breast. Okay, so it's like a ladder approach. Each child is different in terms of some may do that whole sequence of events over 2 months, some may take 2 years. And when we're looking more at problem feeding, we are filling in those gaps in the meantime with some supplements, right? Just a kid's multivitamin, more or less, so that we're removing the pressure around the malnourishment. And we're looking at the specific struggle that they may have with the food. Is it a texture? Is it a taste? Is it a color? Is it the setup of the meal, right? Is it more around the relationship of they want the control around the food? And there's a ton of different reasons behind. There is also, under sort of the diagnostic criteria for eating disorders, we now have its own division, and it's called RFID, which is more the avoidant restricted feeding disorder. So that's sort of where that group, when we move away from just traditional picky eating to more textural food refusal and or just complete disinterest in food. So I find it super, super interesting, but it's also so frustrating as a parent to walk through that because there's not a lot of evidence, there's not a lot of research, there's not a lot of resources out there. So if you're concerned that your child's beyond that sort of picky eating and moving more into the problem feeding, please send me a message because it takes a lot of support, it takes a lot of continued effort and discussion with the kid and working around some of those strategies. Okay. All right. So thank you so much for joining me. Starting next week, I think we are going to just move to a standard time, I think Wednesdays at noon. So please send me in your topics, your questions that you have, and I will see you next week. Thank you.